program is brought to you in association with First National Bank of Botswana.
FNB, how can we help you?
Over the past year of living through the COVID-19 pandemic, a lot has changed, including how we interact with our friends, our colleagues, and loved ones. Jobs have now predominantly morphed into working from home in efforts to combat the spread of the virus. We have now come to understand that the virus was first discovered in Wuhan province in China in December of 2019. It has since spread to the rest of the world, affecting tens of millions of people across the globe. As time passed, we have now come to know that our way of life is not the only thing that has changed, but the virus as well. Presently, we know of the South African variant, the UK variant, and the Brazilian variant. While we are aware of these, it is not quite clear what variant in this case of COVID-19 means, as there are swirling rumors that this virus is a laboratory experiment gone wrong. But what do medical experts say? We have employed the expertise of physician and pharmacologist Dr. Kiran Bhagat for this conversation.
There's just been so much talk around where COVID-19 came from. Perhaps as someone in the medical field, you could tell us what the data is suggesting.
That's a good question, and it's very current as we speak in the first week of April. And I think that the WHO has just completed its investigation. It was permitted by the Chinese authorities to enter into Wuhan, the city that initially reported the cases. And reading the report, it is clear that infections were rising well before the Chinese authorities reported it. That's the first thing that WHO has recognized, that should it have been reported earlier, perhaps something better could have been done. The second is WHO has so far interim conclusion is that it has not arrived from a laboratory. It is likely to have arrived from an animal source, usually described in China as a wet market, where live animals, exotic animals, are captured from the forest and are sold in these wet markets. And current science suggests that the origin is probably from a bat. It's important to understand, as much as the controversy exists as to whether it originated in a laboratory or not, the consequences are out and we need to deal with the consequences. That's the most important thing to say about that. The second is the fact that it is what we call in medicine a zoonosis, which means an infection that has been transmitted from an animal into a human. It's not the first time. HIV is thought to have originated from the simian virus, which is the monkey virus. Zika, similarly, and Ebola as well. So these are not the first viruses which have transmitted from animals into humans. If you speak to many ecologists and environmentalists, one of the main reasons is the increasing devastation of our forests. These forests hold creatures and animals which we are not normally exposed to. So, for example, in the Amazon forest, the Zika virus originated in South America. With the devastation and the gradual destruction of the Amazon forest, many animals are now actually being exposed to humans, and the same the other way around, that have not been exposed before. So the transmission of this type of infection, where the reservoirs for these types of viruses exist in forests and in animals that we're not normally exposed to, are now being exposed to us. And of course, if they are sold on wet markets, in wet markets such as in parts of China, there's a much greater likelihood of its transmission. So this is both an ecological as well as a medical and global phenomenon in terms of how we treat our environment.
I mean, bats have always been around, so it now seems like COVID just sprung out of nowhere. How is it now that bats are responsible for this pandemic, in a way?
It's a good question. It does appear like it has resulted like magic. But the data being reported is that the virus was causing issues much earlier on than was reported in China, and the authorities, I think, were initially trying to contain it and trying to resist release of the information. So I don't think it actually sprung out of nowhere, but I think these wet markets exist all across China, And I think with increasing exposure to these types of bats and exotic animals being sold in markets in China, there clearly has been some sort of transmission that has occurred. And it just so happens that this one found its way to duplicate and replicate and multiply much quicker than previous other types of viruses.
We've heard COVID variants being thrown around, with regards to the type of COVID that has been coming up, from the UK, we've got Brazil, and in our neighboring country, South Africa. But perhaps you could tell us what variant means in this context of COVID-19.
Variant is literally that meaning, and that is that the original, if you like, mother virus, the original virus that originated from Wuhan in China, is the virus that then spread across the world. It's important to understand that everything changes. Influenza changes, tuberculosis changes, malaria changes. As a result, we've had to change our malaria regimen, our TB regimen, our HIV regimen, antibiotics against different infections, because the bacteria and the viruses that we are addressing get smart, and they duplicate and they replicate, and as they replicate, they change. And that change is what we call a variant, so that there is a variation from the original virus to one that has been discovered in the UK or in South Africa or in Brazil, etc. So it's important to understand that these are simply variations. What it is important also to understand is the virus has just changed slightly. There are core elements of the virus that have not changed. And that is the reason why most of the vaccines that are available now are protective even with the variants. For example, we know that the Johnson & Johnson and Pfizer vaccine are particularly effective against the South African B.1.3.151 variant, and the studies show very good protection, because the spike protein, which we've discussed in our previous series, which is the spikes that come out of the coronavirus, is the thing that allows the virus to enter into the cell. That seems not to have changed, whether it's the South African or the Brazilian or the UK variant, and that is the mRNA that we are duplicating in the body, so that the body recognizes that spike and attacks it as if it were an infection. So these variants will come out, and eventually we will be smart about how to change the vaccine. There is a company called Moderna. The Moderna vaccine has now already been modified as a result of the Brazilian and the UK variant, and they're about to get FDA, Federal Drug Administration approval for the release of a variant vaccine that will come out. So that's what a variant means in terms of the nomenclature that people are using without understanding what it means.
In Africa, help is what we do. That is why we at FNB are relentlessly driven to provide real help to you, the passionate and courageous, the creators and the optimists. These are the entrepreneurs we support, the communities we uplift. It is because of you that real help is what we do. FNB, how can we help you?
With all of that information, what are the implications for future pandemics?
The implications are that the virus is going to change. We must always remember that the coronavirus is new to the body. It's not like flu that we see on an annual basis. It is a virus that the body has seen for the first time in its history. And the virus itself also, viruses, in order to be clever, need to ensure that they live for as long as possible, so they don't kill their host. At the moment, what the virus is doing is it's killing a number of its hosts. If it infects somebody, it kills them. The virus has defeated the purpose of living, because it also will die as the person that it infected dies. So the virus is trying to change itself and adapt itself to a variant that will allow it to survive as well as the host to survive. And as a result, the implications are, on an annual basis, probably we're going to have to take boosters or change in vaccines, just like influenza, just like a change in the protocol for TB or HIV or blood pressure or diabetes. These things change on a regular basis. I mean, the only absolute in life is that everything changes. And so it will be that the future of these pandemics will be that, one, it will become an endemic situation. The second is that the technology that we have today, the mRNA technology, has been something that we will take on board and allow us to change at the drop of a hat, tweak certain things within the vaccine that make it ready, just like the influenza vaccine, to be protective against the variants for future pandemics. I think what's also important is that the world at large, and particularly organizations like the WHO, are now going to be more prepared to battle new pandemics, because then new pandemics will come across as life progresses. This is not the first and not the last of pandemics, and so I think the preparedness with which the global community is going to brace itself in the future will have changed.
Okay, I want us now to talk about the current vaccines in relation to the new variant. How much cover do I have against getting infected?
So there are different types of vaccines on the market. I think the public are more aware than any other drug on the market about the different vaccines. So there is the Chinese variety of vaccine, which is what we call the attenuated vaccine, which is the traditional type where, like polio and measles, you make the virus so weak that it cannot actually replicate, but the body will recognize it as a foreign protein and develop an immune system to it. And there are two Chinese vaccines available. One is called Sinovac and the other is called Sinopharm. And it has been rolled out in the Middle East and in parts of Asia, and the data shows that it is effective, and WHO is currently reviewing its guidelines as to whether to endorse and approve it as something that can be recognized as a vaccine for the global community. There is the Russian vaccine called the Sputnik vaccine, which has limited data because we don't have much information on it, but it has already been rolled out in Brazil, in parts of South America, in parts of Eastern Europe, particularly in countries like Serbia, and there has been significant evidence that it is effective against the COVID variants. In this part of the world, we have been relying on what's called the COVAX program. The COVAX program is initiated by the World Health Organization and is trying to make sure that there's equitable and appropriate distribution across the world. As you're aware, there's been political hiccups in that many countries have been hoarding vaccines, 2 or 3 times the number of vaccines that they actually need. In North America, in Canada, we now know that in Europe, certain countries are withholding the release of AstraZeneca vaccine for themselves. So this has become unethical and immoral, if you like, and the WHO has insisted that there must be an equitable distribution of these vaccines. So the vaccine in the COVAX program will be the Moderna vaccine, the Johnson & Johnson and Pfizer vaccines, which are American vaccines, and the AstraZeneca vaccine. So all these vaccines have been trialed against the original virus and some against the new variants, such as the South African and the UK variant, as well as the North American Brazilian variant. And top of the league currently is both the Pfizer and Johnson & Johnson, which appears to be highly protective against all of the variants that are presently in the globe. Both in those who have had an infection and get the Johnson & Johnson or Pfizer vaccine, but also in those that are unexposed and get the vaccine for the first time. So we wait to see what happens in Southern Africa as the vaccine program rolls out.